Welcome back and thanks for staying on. The World Health Organization says the COVID-19 pandemic aided an increase in malaria deaths. The body says this has hampered plans to eradicate the disease by 2030.
In the face of the COVID-19 pandemic and the restrictions associated and disruptions associated with COVID-19 pandemic, the malaria endemic countries have managed to avert the worst case scenarios that many, including WHO, predicted could happen. So that's a first and very important positive message. Nonetheless, there has been an extra 47,000 extra deaths due to those associated disruptions. We are globally off track in terms of reaching our 2030 targets, and that divergence from the trajectory we should be following from the one we're actually following continues to increase. So this is a big wake-up call that unless we do something decisive and urgently, key targets will not be achieved.
All right, for more on this story, I'm joined now by infectious disease specialist at Right to Care, Professor Lucille Blumberg. Prof, good evening and thank you very much for your time. According to the latest report from the health professionals, the disruptions to health linked to the coronavirus pandemic resulted in 69,000 more malaria deaths in 2020, saying that this scenario could actually could have been worse, but the worst was averted, beg your pardon. What's the link here, Prof, between the malaria fight and the COVID-19 fight?
So, good evening. I think you've raised really important questions. So the preventive measures, teams going out to do spraying or provide nets, many of those programs have been disrupted because of COVID within the teams, or people just not accepting the visitation of the teams. So that's important. Many resources have been diverted from malaria to COVID. And I think importantly, cases of malaria are being missed or presenting very late because of COVID being diagnosed in many of the patients, or people just not seeking care in time.
Yeah, and what's the impact of that delayed detection, but also the delays in treatment?
So there are overlapping symptoms between COVID and malaria: headache, fever, feeling flu-y, occur in both. And because everybody's thinking COVID and hopes that it'll just go away, they don't go to the clinic or health facility for management. And malaria, if untreated, will progress very rapidly within days. So they are either not seeking care or presenting late, and complicated malaria is much more difficult to manage, or a misdiagnosis of COVID is being made in many cases.
There are some parts of the continent who are worried, for example, in this COVID-19 vaccination rollout campaign, that the misinformation that is associated with these vaccines for COVID-19 could somewhat translate into this vaccination for malaria. Is there such a concern, Prof?
So I don't think that's a major issue. You know, vaccination for malaria is a very limited program. It's only done in a few countries as part of the malaria control program, and it's really aimed at children. Whereas the COVID vaccine is aimed at the older patients and more vulnerable patients. So I don't think that's a big issue, but resources are definitely, are not adequate for all these programs. I think many vaccination programs have been disrupted, not just normal childhood vaccination programs have been disrupted. People are scared to go to the clinic, and clearly staff are also otherwise occupied. So, COVID's had an effect on many health programs, both for communicable diseases like malaria, TB, but also non-communicable, hypertension, diabetes, and similar.
Yeah.
So major effects, negative effects.
Is there an overlap as well when it comes to the funders of vaccinations, particularly in low and middle income countries?
So vaccination is a very, very small part of prevention of malaria. It's really only done in less than a handful of countries, recently introduced. So I don't think that's our major intervention preventing malaria. But there are other control interventions, use of nets, indoor residual spraying, and early treatment that I think are critically affected by resources or less awareness of malaria as people think more about COVID.
Right, and of course we were talking earlier on the channel with one of the ambassadors for the malaria for children in particular, of some breakthroughs that have been made, especially in the last 12 months or so. Are those beginning to take effect?
Well, for malaria, it's I think the key interventions remain what they were before. Prevention of mosquito bites through various initiatives. The vaccine program is a very limited one. Perhaps that will change in the future. But I think it's about treating patients early. And I think a key message is if you have flu-like symptoms, fever, you live in a malaria area, you've recently traveled to a malaria area, you have malaria until disproved. And it's, COVID is possible, but you have to exclude or confirm malaria as a first step. And unfortunately, people reach for the COVID test or just diagnose COVID and they are missing malaria. So the patients are not thinking about it, they're presenting late, but health professionals are not thinking about malaria. And that's something that we absolutely need to ensure, especially in our season now, is correctly done. Fever, flu, living in a malaria area, recent travel, it's malaria until disproved. COVID can be considered, but malaria, I think is the key message.
Now, with, of course, those who are in charge of our health systems on the sub-Saharan region, what are the gaps that they need to be closing at this time?
Well, I think it's about strengthening our malaria programs. We've had some initiatives for elimination of malaria, and there's lots of stops and starts. It's not easy. Funding is always an issue, and as soon as you let go of malaria, it kind of bounces back. So I think it applies to all our health programs that have suffered because of COVID. We need to manage all of them and balance what we do. So I think don't forget malaria. It's going to bounce back and then we lose ground. And I think that has already happened. Even before COVID started, I think there have been some losses and after initial gains. And, I think malaria must not be forgotten.
Prof, appreciate your time and thank you very much for joining us. That was there Professor Lucille Blumberg from Right to Care, alerting us, of course, of the malaria making a comeback. I mean,